This chapter is on sexually transmitted infections or diseases. It's chapter 21 in your text. And we're going to talk about the same systems that we talked about before. The mode of transmission is different. Some of the things like a yeast infection can be just because you took antibiotics, it's normal flora, or if you get overgrowth, it can be sexually transmitted. That's what they're trying to say here. But when we refer to a sexually transmitted infection, you just have the presence of the pathogen in the host. The disease is you actually have symptoms. It's already taken hold and started causing problems. And organs affected with females, ovaries, fallopian tubes. Think about ectopic pregnancies if you get scarring, uterus, vagina, and even external genitalia. Males, testes, prostate, gland, urethra, penis. It should say epididymis, which is an extension of the testes. Gonorrhea is the most reported STD in the United States. Neisseria gonorrhea, transmitted through any kind of sexual thing you can come up with. Vaginal, anal, oral activity, any kind of mucous membrane to mucous membrane. And it's transmitted by asymptomatic individuals, so somebody may not know they have it. Females tend to have a vaginal discharge, painful urination, painful intercourse, bleeding between periods. Males have white, yellow, or green discharge from penis. I think they would know to go to the doctor at that point. Painful burning during urination, swollen testicles. And you can get skin lesions, and this is showing the lesion on the skin from gonorrhea. This someone will have to explain to me, but ocular lesions. If you get any of the gonorrhea organism in your eye, it can cause a horrendous inflammation with pus coming out of the eye, and that's going to require not only the oral antibiotics, but eye drops as well. Now, another thing is that gonorrhea increases the risk of other infections, HIV and chlamydia. So you've already got an irritated place, and then you get HIV introduced, and it's more easy to get infected. It can lead to pelvic inflammatory disease, which can cause the fallopian tubes to be obstructed, which can cause an ectopic pregnancy and then death. It can be passed from the mother to the baby, and it may cause infection of the joints, bacteremia, and blindness, and there's no vaccine for this sexually transmitted infection. I knew a man many years ago who was a college student that was blind, and he had gotten, in the birth canal, he got gonorrhea. Syphilis, Treponema pallidum. This is can be passed from the pregnant woman to the child, or from person to person. And there's 3 stages, and incubation time anywhere from 10 to 90 days after infection. Stage 1, you just get a small red sore that disappears and will leave a scar. Now, on a male, it's probably easier to see this, but on a female, there are places you just can't examine, on a regular basis. They require a scope, so the female may have no earthly idea. Secondary syphilis has a wide range of symptoms. I have a picture of the biggest symptom. And tertiary symptoms, gumas, which are the damage to vital organs, and the biggest problem is in the brain. And also, if you have fetal syphilis, damage to the brain is a big problem. This is secondary syphilis. So, say 2-3 weeks ago, you had sex with somebody unprotected, and now you break out in that, time to go to the doctor. This is still treatable with antibiotics, and it will clear up. And this on the hands, these blistery places. That's a pretty dead giveaway. Tertiary syphilis is not a joke, but I thought I'd try to lighten this heavy thing down. Can cause brain damage. Symptoms may take years to show up. I had a student telling me a story about a woman admitted to a nursing home, and they had as their minimum database for dementia patients, they had a syphilis test. Well, the woman said the grandmother that was being put into the nursing home, who was just totally out of it, she tested positive for syphilis, and so they told the family she has syphilis. And they were furious, said, Grandpa's been dead for 20 years. There's no way that she has syphilis. Well, she still could have got it from Grandpa, because maybe she got it 25 years or 30 years ago, and it just stayed there. But the brain damage that's done cannot be undone, but it can be, the progression can be stopped. So our friend here will still probably be pretty crazy, but you keep it from getting worse, if it can get worse. Well, it could cause death. Chlamydia infections, Chlamydia trachomatis, prevalent STD, most prevalent in the United States. Often females are asymptomatic. They have no earthly idea they have it. And anybody, males can be asymptomatic as well. And it can be transmitted from mother to infant. Untreated infections cause serious problems in both males and females. Ectopic pregnancy causes death, and that when you have a tubal pregnancy, which is what this means, and the baby grows bigger and bigger and bigger, it finally ruptures that. If it keeps growing, if it lives, it ruptures that tube, and in doing so, it will often rupture the vessels attached to that tube, and a woman will bleed out in just no time. If you have a woman that comes to the hospital with lower abdominal pain, and she's of reproductive age, and she has low blood pressure and looks pretty pale, you better get her back and not let her sit out in the waiting room, because you're going to be calling the undertaker. Okay, mycoplasma and uroplasmal infections and non-gonococcal urethritis. These are some pretty obscure things, but they're transmitted through vaginal sexual activity. So you're going to give it, women give it to men, and then men give it back to women. Culturing the organism from the placenta or in the urethra or vaginal discharge is the only way to diagnose this, and I am not aware that this is common in this area. A chancroid, again, very rare in the United States. A Haemophilus species affects both men and women. Soft, painful lesions that are highly infective. Diagnosis involves identifying the presence of the actual organism from a lesion or fluids from a bubo. A bubo is a swollen lymph node. Remember bubonic plague? It has these horribly large swollen lymph nodes that then break open and are infective to everyone around. Donovanosis is uncommon in the United States. It's caused by Klebsiella, and the epidemiology has not really been established, but you get painless ulcers, irregular painless ulcers on or near the genitals. It may take up to 50 days, and you have to do scrapings from the lesions for microscopic examination. Viral sexually transmitted infections. HIV, which then can lead to AIDS, hepatitis, genital herpes, and HPV are the ones we're going to talk about. HIV is a causative agent of AIDS. It's the virus. AIDS itself is not a disease but a syndrome. It's because the HIV decreases the immune system. You have many opportunistic infections due to a compromised immune system, and it is considered to be pandemic, transmitted from person to person. It was said at one point that it was only transmitted from heterosexual activity or male on male homosexual activity, but there has been a case documented of female on female activity. It did not say what they were doing, but that's one case. Okay, prevention. If you know that you're going to be horrible and you're not going to use a condom, which you should always use a condom if you're not in a mutually monogamous relationship, they have something called PrEP, pre-exposure prophylaxis. And a lot of people take these, especially in the gay population, gay males. But anyone who is at a high-risk lifestyle, and that certainly can be females too, can take this. Now, post-exposure, I didn't pull up that. It's on the website of the CDC. But if you are exposed to AIDS, HIV, from a needle stick, there is a post-exposure prophylaxis that you take that will keep you from getting HIV. Condoms, and they have to be worn correctly every time, the whole time. I know a beautiful young lady that's 12 years old that they were wearing condoms, but someone pulled it off. And also, I knew a woman who was married to a rich man. Men, keep this in mind. And she wanted to continue milking him for money when she knew the marriage was on the rocks. And she poked holes in the condoms. And she had a baby. And then later on, they had a second one. So, I mean, he must not have been very bright for a rich man. She said, oh, it must have broken. But she had 2 lovely children, and last I heard, she was still receiving child support. So be sure that they're good, and that another thing about condoms, and it's kind of gross to talk about, you have to put lube that's condom friendly. If you put Vaseline or baby oil on them, they rupture and break. They did a demo on this at the school one time. Had one blown up like a balloon, and then put, I think it was baby oil on it, and it popped. Abstinence. If you are abstinent, you're not going to get HIV unless, of course, you're raped or something. Mutual monogamy, and that's the one I choose. It's just too much trouble to be complicated by more than one man in my life. That's all I need is more men telling me what to do. So if you can find one person and settle down and everybody's negative, you're good to go. Hepatitis B, C, and D are infections of the liver. A is a foodborne infection, as we mentioned before. But hepatitis B, sexually transmitted, sharing of needles, like drug addicts, infected mother during birth or during breastfeeding. As healthcare workers, your biggest thing is needle sticks. You're taking blood from a person or giving them a shot, and they're thrashing around, and you end up getting stuck with a needle that's been in that person. And that's for HIV, and that's for hepatitis, and that's for any kind of bloodborne infection, because you spread blood to yourself that way, and it can happen. Now, in veterinary medicine, I've had this happen quite a few times, but it's a pretty low chance of getting anything. If you have, I think heartworms is the biggest risk, and we, in the practices I work in, we keep all the pets that come to us heartworm free. So anyway, the first thing you would do with a needle stick, as I said in other lectures, whether it's you're suspecting HIV, hepatitis, or whether you're suspecting nothing, clean the wound up thoroughly, let it bleed, put a band-aid on it, and go fill out a form wherever you do it. I know the last time I got bitten by a cat that was potentially rabid, it was online. I had to fill out the form, and they had a phone call in no time, and they sent me to the hospital, and it was a real pain. Okay, hepatitis C is transmitted blood to blood or sexually. It can be chronic or acute. And this was a huge cause of death. There was no treatment. There is a new treatment out that is seeming to work on hepatitis C. So this is a really good thing. This was one of the big causes of non-alcoholic liver failure. And now it has been outweighed by fatty liver, which is, I call it sugar toxicosis. You eat too many Oreo cookies every day. I need to be careful about that before my liver starts to grow. Okay, hepatitis D. You can't have hepatitis D unless you already have hepatitis B. It's not a complete virus that can survive on its own. It's only found in people who have hepatitis B. And tests, you're going to look at liver enzymes, and there's also an antibody test, and then they will do a liver biopsy. That sounds like so much fun. Stick a needle through your abdomen and get a piece of your liver out. Okay, genital herpes, highly contagious and very common. Now, herpes simplex 2 is a preferred sexually transmitted herpes. Herpes simplex 1 can cause genital herpes. The way it causes it is if you have herpes simplex 1 on the mouth area and then some way manage to, no easy way to say this, transfer it south of the belt border, it will cause infections. And it can cause herpes simplex, well, 1, but as genital herpes. There are antiviral medications that will either shorten an outbreak, and for the mouth sores, there's stuff you can put actually on them. It'll clear them up a lot quicker. And there's oral medications you can take for herpes simplex 2, and probably make you not infective. But they may not. The problem with ever getting herpes is you're never truly cured genital herpes, and it can get around the condom and escape and infect the skin, which then wanders around and infects the genitalia. So something you don't want to do. I think we should have a whole test kit before we take on a new partner. Test them for everything. Okay, human papillomavirus, most common STD. Now, genital warts. There are many warts that we talked about in another chapter, I think the one on the skin, but the ones we're concerned about sexually is because they can lead to cancer of the cervix, cancer of the penis, and cancer of the anus. There's a vaccine that's only been approved so far for people under 27. Starts at 9. And I think I said this in the other thing. I had students say, well, if I vaccinate my child, then she's going to think it's okay to be sexually promiscuous. The kid's like 9 or 10. I said, don't tell her what it's for. She won't understand. Just give her the shot. Take her to the health department. And she says, what is this for? I said, it's a vaccine shot. And then when you take her back, what is this for? It's a booster shot. You know, she's not going to understand. So why scare her for one thing, and why leave her free to cancer, or him? I mean, who wants cancer on their penis? Okay, fungal sexually transmitted infections. Now, Candida it's a normal flora, and it can cause infection when you get overgrowth. But once you get overgrowth, like you've been on antibiotics, then it can become sexually transmitted to your partner. And I knew a young couple who almost got divorced because the man was 100% convinced that he had an STD and that she had given it to him. It turned out to be a Candida overgrowth because she'd been on antibiotics. And I think they ended up getting divorced a couple of years later. Anyway, it may have been an excuse, but they were both treated. Easy oral antifungals work beautifully for this. Just clear it right up. Okay, balanitis again can be candida of the glans penis, and topicals as well. Jock itch can often be, it could be the candida, but other Taenius species, any kind of fungus. It's just fungus, and you put topical antifungals on it, and just like you would on a foot fungus. Be sure it's labeled for the area. You don't want to put something on that stings. Protozoal infections. Trichomoniasis is a very common sexually transmitted infection. Affects both men and women. Most prominently diagnosed in young sexually active women. Caused by Trichomonas vaginalis, and the incidences are as high or higher than gonorrhea and chlamydia. The way that they diagnose it is they have to observe the discharge under a microscope, and they see the little swimmy thing. Metronidazole or Flagyl is treatment of choice on this, and it will clear it up. Both partners have to take it. Now, there was a case, a couple on their honeymoon, shortly after the honeymoon, say 3 weeks later, the woman was having a problem, and she went to the doctor and was diagnosed with trichomonas. So they each were blaming the other. They had been in a monogamous relationship for quite a while before the honeymoon, and they each were blaming the other. It was causing a real problem. And they finally agreed there's no way we gave it to each other. And they remembered enjoying sitting in the hot tub for hours and hours. So they got up with the health department in the county where they stayed, somewhere in Florida, and had them go test the hot tub. Sure enough, there was not nearly enough chlorine in that hot tub. And they actually pulled water samples, centrifuged them down, and found trichomonas organisms. So they were able to sue the hospital, and I guess that paid their honeymoon and wedding off. It's an easy to cure thing, but it caused a lot of emotional damage. I think the hotel or motel settled out of court on that one. Okay, that's all on this. There's more sexually transmitted infections that are in some of these other countries that are rare and obscure, but your book chose not to go through them, so we'll do the same, or at least the PowerPoints they gave me did. Okay, that's it.